Coming up on the ACSA legislative lunch break, Edgar and I will get you all of your latest news and information from the state capitol and CDE with an in-depth analysis of how it impacts your work. Plus, today, Senator Dr. Richard Pan on the show to talk about the current legislative process and his legislative proposals on vaccinations.
The ACSA legislative lunch break starts now.
And it's a couple of minutes after 1 o'clock. We're happy to have you with us on a Wednesday. It's the live and interactive ACSA legislative lunch break. I'm Naj Alikhan, ACSA Senior Director of Marketing and Communications. And let me welcome, for the very first time on our show, the new Executive Director of ACSA, Dr. Edgar Zazwata. Edgar, let me extend a congratulations. There are many people that have already done the same thing on our comment section. Welcome. So good to have you here on the show, Mr. Executive Director.
Hey, Naj. The first thing I have to say, obviously people see that I'm in a different room, and yes. I don't know if this is because of the change in role or whatnot, or I'm really not in charge here. It's, Naj and Michael. The next thing you know, I have a different setup. So that's one piece. But in all seriousness, yeah, it's been quite a week, and just a quick thank you to all of our members, the outpouring of support. I love all the shout outs over the week of, we'll celebrate with you on legislative lunch break. I love the people that were worried and said, hey, what happens to the lunch break? Does it mean, Naj has to get somebody else? Hey, as long as they'll keep me around, I'm here. So yeah. let's just put that out there. I don't plan to go anywhere on that front, but in all sincerity, it's been quite a week. It's not lost on me that so much of the work that ACSA has done, we've done it together. And I say we, obviously here as staff, things that we've been trying to publicize over the last couple of years through these mediums, but our members, this interaction, the advocacy, everything that we've done, especially during these difficult times, it has been a team effort. And so just, I appreciate everybody's sincere thoughts. I have to say this little story. I was telling Michael backstage, and our members helped make my parents happy. As many of us could relate to this. I call my parents after I get the news last week and tell them about the new job. And, they kind of understand what I do, mostly understand what I do, and so they were happy. They congratulated me. It wasn't until a few days later when they see the ACSA social media, going wild and people saying congratulations in the comments. It wasn't until my parents saw the ACSA social media that they said, oh, this is a big deal. And my mom calls me almost in tears because she's so proud because of how many people have congratulated me on social media. So thank you to you folks for making my parents happy. And then lastly, and because I know we have a lot to get to this week, this is the thing that I know, and I know this goes for you, Naj. This place, we love working here. We love our members. But as I've been saying all week long, it's not lost on me. This is not our organization. This is our members' organization, right? Yeah. We've been trusted to keep it on a good trajectory, to do what's right by our members. And I think that's the part that gets me. And that's the part that motivates me. And I know as a collective, we're going to try to keep this thing going and make ACSA valuable to our members, be on the forefront of advocacy. So obviously look forward to the work ahead, but just a sincere thank you for everybody who's reached out and just for the support, but more importantly, the work that has been done as a collective over my time here. And we have a lot of work to do moving forward.
Absolutely. We'll talk a little bit more about Edgar's new role a little bit later on in the show. I want to say hello to Ellen Wheeler, who was on our chat first today, Sheldon Smith, Heather Armelino. I do have to just say this really quickly before we bring in our guest today. It was Marie Russell from Turlock Unified, the CalSPRA Communicator of the Year, who emailed me Friday after the announcement was made and says, I guess I can't joke around with you as much as I normally would.
I don't know if that's going to stop you. We'll see about that.
We'll see about that. Yeah, we'll see. We'll see how that goes. All right, let's go ahead and bring in our guest right now. We'll get straight to it. Senate District 6, our senator here in the Sacramento area, Dr. Richard Pan, a pediatrician, former UC Davis professor. Dr. Pan, it is an honor to have you here on the show with us. I know our members, I know everybody in public education very anxious and interested to hear from you today. So thank you. It's an honor to have you. I want to go ahead and start right with this. Walk us through some of your public health and vaccine initiatives. Let's just go ahead and talk broadly about that.
Yeah, no, thank you so much for having me here. Actually, one part of my biography that you didn't include that I want to mention is that actually prior to being in the legislature, I was a medical consultant for Sacramento City Unified School District. So as a physician and pediatrician, I actually focused a lot on school health and worked very closely with school personnel, school nurses, psychologists, and teachers to improve health in schools. So certainly school health is one of my passions. And we want to be sure we keep schools safe for kids. That's what parents expect from all of us, that schools are safe. And I know that that's what your members care about as well, right? You want the students to learn. You don't want them to be distracted because there's other stuff going on in schools. And certainly spread of an infection is not a good thing. I mean, I think as a parent, I have 2 children in school. You get those notices. Oh, someone had head lice in the class, right? Or someone had came down with some other or something else happened, and then worried parents call and say, "Oh, what's going on?" Right? And so we need to work together to keep schools safe. We need to also work together to be sure the parents know what's going on in their classroom, that they feel assured that their kids are safe. And I know that many of your members also work with. We have children who are vulnerable to disease. They have, they're in special education. They may have disabilities. They may have other health issues. They're immunocompromised. They all deserve an education, so they're at school. So in terms of our legislation, as we're trying to deal with this COVID pandemic, we need to work to try to keep schools safe, and that means supporting schools. So, for example, I'm authoring a bill to have schools do testing plans, but also to try to secure funding to support those testing plans, because we want to be sure that parents have accurate information about what's going on through their schools. They want to know when they send their kid to school that their child is not going to be exposed to COVID or any other serious disease, right? We want to make vaccinations more accessible. We know that vaccines are a cornerstone to stopping the spread of infectious diseases, things like measles and polio and other diseases in the past. But also, with COVID, we know that COVID vaccination helps protect kids, protect staff as well, the teachers, so the school personnel as well. And we need to be sure that schools are empowered and school districts are empowered and your members are empowered to keep schools safe. Because when schools aren't safe, or a lot of the staff or teachers are absent because they may be sick, or students are absent when they're sick, that hurts schools. That hurts your ability to educate. When you need the students to be there, you need the teachers to be there. Yeah. Otherwise, the kids can't learn. And so that's very important. We want to continue to work with school districts to be sure that administrators and school leadership has the tools they need to keep kids safe in school. And that's going to be very important. And of course, we want to improve efficiency. So for example, Assemblymember Weber has a bill to make the Immunization Registry information available while protecting privacy, making it available to school districts so that you can more efficiently and effectively identify where the gaps are in terms of immunizations, but also to verify information with, of course, the permission of the parents, to verify information that's necessary to, again, keep schools safe, right? And so we want to work with you to be sure that school districts and schools and school administrators can focus on being sure children are getting a good education.
Dr. Pan, first of all, let me give you a thank you for joining us today. I know, and we'll get into this a little bit later, but I know you've never shied away from controversial topics, and that you have a track record for taking on some of these tough issues. And we'll be curious to get your thoughts on just, from a perspective of somebody who's been in this middle of the fight. We'll get back to that. And then also just to go a little bit about your background. I know, as being here from the Sacramento region, I think your expertise is appreciated, given that you were on the front lines. I know folks and families that you were their pediatrician, right? This is not theoretical for you. You've been there and you've been treating kids. So just a little bit of gratitude there. Going in a little bit different direction now. Obviously, when you introduced this bill, we were in a different place in terms of what the health landscape looked like. I think we were right on the in the middle of the Omicron wave. We were right in the middle of the fire, right? As we know, things have changed a little bit. Just a few statistics. We see that we've seen data on the asymptomatic students. The guidance has changed that those folks can stay in school now, regardless of vaccination status, given some of the changes from CDPH. We've seen that the test positivity rate is changed. We're below 1.5%, at least based on some of the latest numbers. So given just the collective here, how things have changed, and we've seen in other industries some of those mitigation efforts that we saw at the beginning, requirements for vaccination for indoor settings. Obviously, we had a lot of changes with masks. Has that changed your perspective here in terms of how you viewed this bill when you first introduced it, or has it changed even your perspective of some of the particulars, the language, or some of the requirements that you had in there? So, just big picture, how has your perspective evolved as the health situation has evolved?
So we're learning more about this virus, and we're learning more about many of the things that we need to do to try to stop the virus. So in terms of this virus, we've suffered many different waves. And unfortunately, until we're able to essentially vaccinate the world, we're going to continue to get new variants. In fact, the Omicron variant was particularly worrisome because it's disproportionate impact on children. So early on in COVID, in fact, people were saying that, well, it doesn't really spread at schools. Although keep in mind that at that point in time, there were many fewer kids in person learning, right? And so schools weren't really seen as the centers of transmission. But now that we have more kids actually in school, and we want them to have in-person learning, that's part of the reason for the guidance changes. We are seeing more outbreaks happening where the schools are the center of transmission. And that's not surprising because, for example, for most other respiratory diseases, for example, like influenza, schools are centers of transmission. So, and the fact that children may not be as severely affected as adults, by the way, that's true of most diseases, actually. Children tend to be more resilient. That doesn't necessarily mean that children aren't affected. In fact, over 1,000 children have died of COVID, and many other have developed very serious consequences of being infected. And that's concerning to families, but also families have vulnerable members at home. So they send their kids to school. When they come back, they don't want them bringing home a disease that could actually send one of their their parents or grandparents or someone else in the household into the hospital. So we need to be sure that schools are safe. Otherwise, parents are going to be afraid of sending their kids to school. We've actually seen this. We've heard from parents who are worried about sending kids to school because they're afraid that if the school doesn't have appropriate mitigation in place to try to stop the spread of COVID, then that disease will spread. So there's many things we can try to do with COVID. So one thing is actually improving ventilation systems, right? Because this is an airborne disease. So if we improve ventilation and invest in doing that, that will reduce transmission. Now, we've talked about masking. And in fact, when the case rates are low, then there's fewer opportunities for people to spread the disease. But when they go up, that goes up as well. And so the more virus there is in the community, the more likely it will spread, and the more likely it'll show up in schools and continue to spread in schools. In fact, right now, if you look at what's happening out in Ottawa, in Canada, they don't have formal lockdowns, but there are so many teachers and staff and students who are absent because of COVID infection that effectively their schools have shut down because there's just not enough teachers and substitutes left to teach the kids, and then many of the kids are absent because of infection. So we need to keep in mind that it's not just the formal mitigations that come from.
Oh, did we lose Dr. Pan?
I do want to mention that what we're learning about COVID right now is very worrisome. So, for example, COVID has been demonstrated to cause loss of brain tissue, right? So, does that happen in children? We don't know, but we know it happens in adults, right? People who get COVID a year later are more likely to develop heart problems, strokes, more likely have diabetes, their long-term neurological impacts. And so I think that indicates to us that if we can avoid people getting infected with COVID, that includes children. We don't, if we can avoid getting them infected, we should try to do so. And actually getting an infection doesn't mean you can't get reinfected. In fact, there are many cases of people being reinfected. And with each reinfection, there's an increased risk of a bad outcome related to that infection. So while the vaccines themselves aren't perfect in terms of preventing infection, neither is being infected either. And we need to think about what can we do to keep our kids in school, keep them safe so parents feel comfortable sending them, and also preventing injury or to both our students and the staff who work at the school and the teachers.
Mm-hmm. Dr. Penn, let me ask a quick follow-up just because I know I want to make sure this gets lost. It's at the heart, and you've heard this because you've been in the middle of this. Mm-hmm. So the personal belief exemption. Mm-hmm. I think that's the place where you hear probably the most angst. And I think to appropriately convey some of the concerns we've heard from our members, it's not because of views of the effectiveness of the vaccine. It's just because of what the impact might be on families and what the impact may be on folks. We've seen attendance numbers this week that enrollment is going down, and mm-hmm. folks fear that we're just going to lose a lot of students if we're too aggressive on that front. Just maybe quickly react to that, because I know it's a theme that you hear a lot, and frankly, it's something that we've heard from our members throughout this discussion.
So, in terms of enrollment being down, we have to keep in mind that we're still figuring out why, right? So they haven't all gone to private school because the enrollment in private schools hasn't increased the same. They haven't, people talk, it's not a shift from public school to charter schools. Charter schools have also seen declines in enrollment as well. So charter schools are public schools, and then the regular public schools. So we're still trying to figure it out. But I will also make note that we also have parents who have not sent their kids to school because they're worried about the kids getting infected and bringing it home to their families. So it's not just that, there's people who don't want to get their children vaccinated, and they're the ones who won't bring their kids to school. There's also families who, if you don't do mitigations, are concerned about people bringing the disease home. So we have to look at all of these different factors and evaluate what's necessary. But certainly what you don't want to do is be responsible for a child or a family member having gotten sick because we didn't do what we could to try to reduce the spread of the disease in the school. And vaccinations are a cornerstone to trying to reduce the opportunity for spread of disease. And also, if someone gets infected, make it less likely that they will actually get hospitalized or have long-term impacts from the disease.
Dr. Pan, we're getting a lot of questions, and let me just get this one in from Garrett Carr, who's a vice principal over in Bishop USD. Garrett asks, is the bill you're authoring mandating vaccines for students or just making the vaccine more available to students? Can you just clarify that for us?
Yeah. So we actually need to work harder in making the vaccines more available to families. So one of the things I've pressed the administration on is that we need to be sure that vaccines are available in doctors' offices and clinics and other frontline places where people normally get their children vaccinated. A lot of times we tend to focus on mass vaccination sites. Certainly doing vaccination sites at schools is great, but oftentimes parents have questions. I'm a pediatrician. I see families and they may have questions. And so if you don't have the people present to answer the questions and then be able to administer the vaccine as soon as they get the questions answered, then they're less likely to get vaccinated. And that causes problems for the school. So we need to do a better job of getting access to vaccines for families combined in places where they're used to getting the vaccines and also can get their questions answered. So certainly doing more vaccinations in school sites is going to be very important and help makes it more accessible. But a lot of times people are used to going to their doctor's office, their child's doctor or their other health professional, and having that discussion first. And then they say, yes, I will get my child vaccinated. And if the vaccine's present, they'll get it. Now, if it's not present there, their parents are busy. So they may not necessarily follow up as much. So we have to work harder in getting vaccines available to families through the usual places they're used to getting the vaccinations for their own children. It's a little different than adults. So, people are used to going to certain places for children. We need to be sure that the COVID vaccine is actually available in those sites.
Mm-hmm. Dr. Pan, like Naj said, we got a ton of questions, which we expected. We knew that this is going to have some interest. So we're going to try to rapid fire here so we get as many in as we can. Daryl Camp was superintendent, one of our ACSA leaders, brings up a good point. Actually, this captures a theme that we've heard a ton from our members. That you mentioned the possibility of having schools develop testing plans. And I know that you have some legislation that puts some requirements in terms of what schools need to do. One of the themes that you probably have heard is that while schools were at the epicenter and were proud to do what they could, not only to stop the spread of the virus, but also to keep schools open. And that was something that they did, right, over and over the pandemic. Now, one of the things that we've heard is that more and more, it's taken us away from some of the core functions of schools, which is teaching and learning. So Daryl asked that, hearing your statement, is this another under-resourced mandate? And can other agencies assist? Is there a role? Because schools have a role, but should they be serving the primary role when it comes to COVID testing or some of the other mitigation efforts that we've talked about?
So I would just say that as someone who used to be a medical consultant to a school district, is that, yes, your primary job is to educate, but you can't educate a student who's not there. You can't educate students.
We're hoping we'll get them back here.
Let's see if the video catches up for us. We want to thank all of you for
there we go. We got him back.
Dr. Pan, we got you back.
All right. Looks like so I just want to say is that, first of all, of course, in order to teach students have to be present, and teacher and staff have to be present. So when there's disease outbreaks, unfortunately, that interrupts education. And so so in fact, we are trying to get resources through the testing bill, right? We want the Department of Public Health to provide guidance and support to school districts. So you're not on your own, right? We don't expect you to go out and try to figure this all out yourself. You're going to need help. And also, we are tying this to resources for school districts, because we know that takes staff time. It takes money for schools to be able to carry out appropriate testing plans as well. So we are working to get those resources to school districts so that schools are able to carry them out. But more importantly, we want to be sure children get educated. So we need to be sure that schools are safe places. Parents want to know, if I send my child to school, if there's COVID there, has my child been exposed? Is my child getting infected there? And that's part of, again, a very important reason for the testing plans, is that parents want transparency. They want to know. I mean, right now, schools send out notices if someone has head lice. Head lice isn't going to kill anyone. But, if you stop doing that and someone's child gets head lice, they call your office and say, why didn't you tell me?
Yeah.
There's head lice in the classroom, right?
Yeah.
So parents want to know. We need to help support those parents as well.
Dr. Pan, I'm going to try and put a couple of these questions together because we know that you've got limited time with us. Dave Garcia, one of our ACSA board members from Empire Union School District, asks, where does choice fit into the vaccination equation? And then the second part of my question is going to be related to vaccine durability and long-term studies effectiveness for boosters of students. Just if you might be able to summarize. So Dave's first question about choice, and then second about the long-term, short-term studies.
So in terms of choice, parents have a choice to decide whether they want to get their child vaccinated or not. That choice is not taken away, but there's a consequence to that choice. And that consequence is not to punish that parent or that child or that family. We also have to think about the choice of families who have children who are immunocompromised or have other conditions that may mean that the vaccines aren't as effective for them, right? Or they can't get vaccinated. And they may have family members at home. So you may have a child who has a family member at home who's at risk. They need to have choice too, right? Because they don't have a choice. If they see that there's a COVID outbreak going in the school and the school's not trying to mitigate, their rights to an education are being taken away. Okay, so let's be clear about choice. All right, so the most important thing is that every family and every child should have the choice to get an education. In fact, it's a right in the state constitution, and we cannot let other families take away that right from those families who have a child just because are immunocompromised or they have someone at home who is at risk for COVID, that their rights are taken away for an education in your school district. So let's just be very, very clear about that. In terms of the COVID vaccine, we know that the COVID vaccine is safe and it's effective. Now, I'll tell you that, again, COVID's been around for just a little over 2 years. As I said earlier, getting a vaccine, it's not perfect. There's nothing 100% in the world, like even seatbelts. But I also point out that there are some people who say, well, just let people get infected and that will help protect them. That doesn't work either. And by the way, that includes the risk of actually getting infected with all the long COVID and the other things I talked about. So that's not an answer either. So what we do know is the vaccine helps protect the person who receives it from being very sick. And it can reduce, doesn't eliminate, it can reduce transmission and other effects. But that's why we have to combine it with not only just vaccination alone. Sorry, vaccine isn't a silver bullet either, right? That's why we have to combine it with other efforts like improving ventilation, masking if necessary when there's high case rates in the community, and so forth. So so we need to figure out how do we reduce the amount of preventable spread in schools so that we can ensure that all children are safe.
Mm-hmm. Mm-hmm. Just want to let all of you know, Dr. Pan's team is behind the scenes with us. So they're taking a look at all of these questions that are coming in, and hopefully that shapes a little bit more about the messaging. Dr. Pan, it's been an honor to have you here on the show with us today. Have a great rest of the day. Good luck to you. And we'll have you back again.
And
soon.
Dr. Pan, I'll make one last pitch.
Yes.
Given you've seen the amount of interest, you already knew there's a lot of interest.
Yeah.
Obviously, as this process evolves, we'll invite you back. I know there's a lot of topics we didn't get to, so if you're open to it, maybe we can have a part 2 of this conversation moving forward.
Yeah. Well, thank you so very much for having me, and I want to thank all of your members for all your hard work. Continuously, but especially over the last couple of years. I know that you're working very hard to try to be sure we get our kids educated. As a physician who was a medical consultant to a school district, I do understand many of the struggles that you're facing. And certainly as a state senator, I've worked with many of my school districts as well to try to address these issues. So again, thank you so very much for having me here. And I want to thank all the people who are watching for your hard work to be sure we keep our children safe at school and educated. And let's continue to work together to be sure we keep them safe.
Yeah. Thank you, Dr. Pan, very much. That's Senator and Dr. Richard Pan, Senate District 6 here in the Sacramento area. Dr. Pan, thanks so much for that. We'll head some news in just a moment. Let me just give you a little bit of a promotion on 2 important events that are coming up. Our Equity Institute, April 28th through 29th in Pasadena. Tyson Amir and Dr. Renetta Garrison-Toe will be the keynote speakers for that, the Equity Institute. And then for the very first time, we're going to have the ACSA Lead with Pride Conference. That's May 4th through 5th in Oceanside. Amy Schneider, who some of you may know as the Jeopardy champion, will be one of the keynotes. Also, Dr. John Paul Higgins will be one of the keynotes. For more information and registration, go ahead and go to ACSA.org/professional-learning. Also, if you like what you've seen, and I will tell you that this is the 5th lawmaker we have brought on here at ACSA in the last week and a half for you. We invite you to join our ACSA Legislative Lunch Break family. Subscribe to us over on YouTube. Last week, we went over the 2,500 mark. Also, like us on Facebook. You will get instant alerts when we're going to come on the show, when we're going to have a live broadcast for you, whether it's Wednesday or any other special edition. One of the funny comments that I've heard from one of our members, they have said, if a show is coming on and it's not Wednesday at 1 p.m., we know it's a big deal. So go ahead and subscribe and like. We definitely appreciate that. Well, as we mentioned at the top of the show, we at ACSA very, very thrilled to have our new executive director. And of course, that is my co-host, Dr. Edgar Zaz.
Oh my God!
And we're going to take you live into his office.
I don't know if I'm coming from.
Edgar, I get.
I can't hear anything you're saying, Naj. So, oh my God.
Did they scare you?
I'm a little scared. Thank you.
We wanted to give
I don't know. For those of you that have been around for a while, I don't know if I lost my Kumor here or when my son tried to take the ear piece out of my head. So obviously, it goes without saying. Like Naj, you and I get a lot of the FaceTime here, especially over the last couple of years. But it's all the people standing behind us, standing behind me, that makes this place work. So just saying.
Now, guys, don't forget he's the boss. So let's make sure that people remember that.
So we're not going to get back to the vaccine conversation.
You know what? We'll a big thank you to all of our ACSA staff here in the Sacramento
I can't hear anything
office.
you're saying.
No, that's fine. Edgar, we'll save it till
Whenever you don't want to go through these questions. I was ready, geared up to reflect on Dr. Penn. I guess this is all waiting till next week.
Hey, I think what we'll do is we will take the questions that
I'm not even going to try right now. I'm not going to try.
And we will send those to Dr. Pan's office. We will have his staff go ahead and give us some feedback on that.
All right. We'll talk about it on the front end next week. Then I had some thoughts. But we'll wait for those till next week.
Yes, keep those till next week, folks. We are on the air next week, live and interactive, 1 p.m. here on ACSA Facebook and ACSA YouTube. Edgar, have a great rest of the day.
I don't know if anybody's going to top this.
Yeah. And folks, thank you so much for joining us here on the ACSA Legislative Lunch Break. Again, we're on the air next week, 1 p.m. live and interactive on ACSA Facebook and ACSA YouTube. Have a great rest of the day and great rest of the week. We'll see you next week right here.